can they understand these guidelines?
Currently, there is not a patient-friendly version yet. Because of the interest of the Florida Sickle Cell Disease Research Consortium, I have become motivated to develop a patient-oriented document so that patients can have something that they can tap into. And I will tell you that this is under development, and I hope to have this done in the next few months at the most.
So what would you say is the main, why are these guidelines important?
So these guidelines are really trying to clarify the field, and so I think if I think back to this field 10 years ago, and I think back to this field 15 years ago, what I think of is a lot of different clinicians trying to do the best thing for their patients and trying to put together data that has been generated by different institutions and trying to apply it to their individual patients. And how that ended up coming out is different things happening at different institutions. And what these guidelines are really trying to do is to try to unify the approach. And while our unification strategies may not be necessarily perfect in all situations, I think that in a lot of ways these guidelines are going to help clarify the field and really clarify what needs to be done in the future and what research directions really need to be pursued in this field.
All right. Well, thank you for all the information. We also have with us Dr. Lanetta Jordan, President and CEO for the Foundation. Dr. Jordan, the Foundation has a large Facebook audience of more than 12,000 individuals with sickle cell trait or the can I say that? Okay. The Foundation has a large Facebook audience of more than